Our next presenter is Brian Kinslow. Exercise is medicine, but who prescribes it? And his advisor is Dr. Megan Warren.
Good afternoon. I'd like to start with a question. Have you ever been prescribed exercise by a medical doctor in the same way that you might be prescribed a medication? Physical therapists focus on exercise science and how exercise affects the human body, as well as its impact on most diseases, from diabetes to cancer to Parkinson's disease. Exercise can be used as medicine, and physical therapists, contrary to common perceptions, don't just treat injuries. Rather, we're doctoral-level medical professionals that can prescribe and dose exercise like a physician might prescribe a pharmaceutical. But we all know people are not exercising enough. Obesity is an epidemic, and rates of other preventable diseases are on the rise. My research delves into a few questions. Why are people not exercising, and what can the greater medical community do to help people exercise appropriately? The research has involved data analysis of a large nationwide health survey conducted by the CDC. I waded through thousands of variables and came to several illuminating data points. Here's what I found. Doctors are overwhelmingly telling their patients to exercise more. This is a good thing. However, almost 50% of patients who've been told to exercise more by their doctor have at least one medical condition that would make exercise difficult or dangerous for them to do on their own. For instance, over 25% have diabetes, and about the same amount have a serious functional limitation, such as difficulty climbing up a set of stairs. So my data shows that the problem isn't simply that people are not engaging in exercise, but rather an enormous percentage of the population cannot exercise safely or effectively on their own. If you see your family doctor with a complicated skin condition, you'll likely be referred to a dermatologist. But if you see your doctor with an equally complicated condition that demands treatment with exercise, my data, unfortunately, shows that patients are not referred to see a physical therapist and are not getting the help that they need. In order to make a difference in preventative health, the medical community must change its current paradigm. My research helps that process in two ways: by identifying patient populations who are in dire need, and by giving physical therapists meaningful data they can use to clear up misconceptions about their profession and work with other medical providers to increase referral rates. By defining the problem, my research is a starting point to help us all work collectively to a stronger, happier, and healthier society. Thank you.